a patient 36-year-old came in the emergency with complaints of pain and fever in the right lumbar area for 2 months. Now we start scanning of right lumbar area. Here we see the right kidney. The cortex of right kidney shows heterogeneous texture, hypoacuic and hyperacuic texture. The size of cortex at mid-pole is thickened due to infection. Here we also see a well-defined lesion in the upper pole of the kidney. Now we measure the size of mid-pole of cortex, which is 2.9 millimeter, which is mildly thickened. Here we see an oval shaped stone in the lower pole of kidney. Here we see the shadow of this kidney. Now we measure the size of stone. The size of stone is 38 millimeter or 3.8 centimeter. Here we see the well-defined polycystic lesion in the upper pole. There is also a dilatation of major calyces. Now we see the solid cystic lesion in the upper pole, a hypoacuic and hyperacuic lesion. Now we measure the size and or volume of the lesion. For volume, we need two view of lesion are transverse or and oblique view. The volume of this lesion is 14 milliliter. This is a collection or abscess in the upper pole. Now we see the pelvis, which is mildly dilated. If we see the fluid in the pelvis, it contains echogenic debris. It shows the infection is spread in the cortex and medullary area. Now we scan the left kidney. The cortex of kidney is normal and pelvis is also normal but mildly dilated. As we see the fluid in the pelvis, no mass or lesion seen in the cortex of the left kidney, and no stone or other pathology seen in the pelvis. The proximal ureter is not visualized. Now we also scan the urinary bladder, which is partially filled and contain no stone or mass. The walls are also appears to be normal and thin line. If we see in the bladder, we see some echogenic debris in the fluid. Now how we will write report. The right kidney is normal in size. The cortex shows heterogeneous texture. The mid part of cortex is thickened and inflamed. Measuring size is 28 millimeter. There is also a well-defined solid cystic area in the upper pole of the cortex. Measuring volume is 14 ml, which is abscess collection. The major calces are also dilated and contain Debinus fluid. An oval-shaped calculus size 38 millimeter also present in the lower pole of the kidney. The left kidney is normal in size and texture. No mass is seen. The major calces are mildly dilated, but no calculus seen. The ultrasound diagnosis is pyelonephritis with pyonephrosis and a calculus in the lower pole of kidney. The patient is referred to the urologist for management.